I wanted to take the video a step further with explaining the development of discomfort and then why it could be uncomfortable when you finally get intervention done. So when I was 9, I could skate, but pushing off this leg was funny. Standing on this leg to push off on this leg felt more unstable. That persisted to me not being able to extend very well. I couldn't reach back or lift my leg or do that scorpion move, whatever. And I thought it's just normal for me, it's just normal. And then as I grew older, low back pain. I developed this pain. And then I noticed I would wake up with a crick in my neck that would take a week to resolve, once a month, every month. Now everyone thinks it's just due to age, and it really is just something that we get told and we just start to believe because everybody and their mom says it. However, mechanically, this hip was losing mobility. So as I grew and my bones grew and the lever pulley system around each area compensated, I allowed myself to drift further into keeping this area tight, so this area did more work. What happened over time was that I lost the ability to sit into this hip, and so I became zigzagged. So when you can't sit into a hip, your spine just inadvertently shifts away from that side. Then, in order to stay in midline, your upper body may shift this way, then your brain's thinking, like, we're not where we should be, and it'll either go sideways or you'll notice a head tilt. And then you notice one shoulder bothers you, one knee still bothers you. These are mechanical shifts that happen over time. Is it due simply because you got older or because you shifted more and more over time until your body lost the space this way and this way to compensate? So if that's the why, by the time you come in here, in your brain you think, well, my pain started last year, 3 months ago, 3 weeks ago. So you think your issue began then, but really that's when your pain began because your body couldn't take it anymore and then started with the pain. So then you think, well, years before that, I didn't have discomfort, so how could it have started prior to then? As your body was shifting into these lateral shifts and rotations over years, you just felt those minor aches and pains that would resolve, stiffnesses that would resolve, because you were slowly shifting and you just assumed all of those sensations were normal. By the time you come in to see me and you're in pain, you're in maximum locked, shifted zigzag position and in pain, but it takes time to come out of that. But it also is going to take some force, effort, and discomfort to initially break loose of these lateral shifts and rotations in order to be able to receive the treatment without it feeling so uncomfortable. So when it comes to these videos where, can I do something on my own? Of course you can do something on your own. So I tried to do things on my own, and I worked on hip joint mobility and hip joint mobility videos. Now, this exerts some force. This could help me get some hip extension. Now, these are useful. You have to be broken loose first, meaning I do these till the cows come home. But if I do not have restored anterior joint mobility of someone having used some force to deliver this bone to be able to stretch and shift this way, this will plateau. This will only give you so much benefit because it has limited force it can apply. I'm weight bearing, my muscles are on, and this can only pull so much. So when my patient talks about how initially it was bothersome to receive treatment, or you wonder why it takes force or it hurts so much or whatever, remember the state you're coming into me and that it took 10 to 12 years for you to get there. But I'm trying to get you out of that position, loosen everything, and then get you to relax while you're receiving it. It can't be pain-free and it can't be without some discomfort because I'm using several hours to compete with 24 hours a day, 7 days a week, 52 weeks out of the year of the last 10 to 12 years of your life. Will it always be uncomfortable? Like she said, no. but just take into account you weren't feeling pain as you shifted into those positions, but to come out of them in a matter of hours does take some discomfort, but that's where communication is key. So I do everything at your pace, the way that you can receive it and you feel safe with it.